In this video, we'll compare and contrast how the United States and Canada approach obesity prevention and treatment, from policy decisions to healthcare strategies, highlighting key differences, similarities, and what each country can learn from each other. We will begin by comparing the governments of both countries. The U.S. government is working to track obesity-related factors and fund programs that promote healthy eating, food and nutritional security, and physical activity. Diving further into the U.S. government, they work to provide front-of-package labeling, fiscal incentives and disincentives, and appropriate standards for trans fat, added sugars, and sodium. Additionally, the government is working to ensure the availability of free and safe drinking water. In the U.S., the government has several different tactics to fight the epidemic. One of them is through supporting families and their children who are at a greater risk of obesity. They do this through services at federally qualified health centers, Head Start, WIC, and similar service agencies. The government also funds programs along with providing training and resources for ideas that encourage health habits such as healthy eating and physical activity, and food and nutrition security. A program example is SNAP, also known as Supplemental Nutrition Assistance Program. For families with lower incomes, the government helps provide affordable and nutritious food via programs like the Supplemental Nutrition Program for women, infants, and children, and various farm-to-farm education programs. The Canadian government follows similar guidelines to the U.S. government with the promotion of healthy eating, an increase of overall physical activity, improved surveillance, and various other implemented policies. After a closer investigation, it is apparent the Canadian government is working on the elimination of industrial trans fats, along with the restriction of marketing of unhealthy foods and beverages to children. The Canadian government has introduced the Healthy Eating Strategy, which aims to improve the nutritional quality of food available to Canadians. This includes banning the advertisement of unhealthy products to children and the recommendation of mandating labels on the front of the package to make it easier for consumers to make the right choice. They also work with companies to limit the amount of salt, sugar, and saturated fats in processed foods. Public health considerations, pre-market safety assessments, and regulatory framework all factor into these limitations. Finally, their government introduced the Participation Campaign. This campaign works to reduce personal, societal, and systematic barriers, identify and provide opportunities for increased physical activity, and inspire people to value their own lives. Moving on to the healthcare systems for both countries. In the United States, we have healthcare providers that scan for obesity in patients. We also have updated our diagnostic codes for obesity, allowing for more accurate diagnosis. Additionally, we evaluate patients for obesity-related diseases. In the U.S., our healthcare system focuses on treating overweight patients with a non-stigmatizing approach. Some of the main strategies of this include family health weight programs, anti-obesity medications, including lipase inhibitors and self-injections, and evaluations for metabolic and bariatric surgery. To relieve obesity stigma in the U.S., our healthcare system offers certain healthcare to get special counseling with empathetic techniques. Our healthcare system is working to end the stigma by limiting labels, identifying and eliminating biases, and practicing patient-centered communication and creating a welcoming environment. On the other hand, Canada's healthcare system has divided its goal of taking down obesity into 3 different plans. Strategy 1 is implementing health services and clinical interventions that target individuals, for example, referring citizens who appear to be obese to get professionally screened. Secondly, the Canadian healthcare system is using community-level interventions that directly influence behaviors of the people. This includes community-organized groups that all work together to fight obesity. Finally, the healthcare system of Canada is working to implement public policies that target social and environmental determinants. This entails providing clean drinking water and ensuring that less fortunate families receive nutritious meals. They also have an assessment known as the 5A's Pilot Project, which has health forms with an outpatient cardiac rehabilitation setting to complement assessment recommendation for obesity management. This project helps healthcare providers gain practical, evidence-based strategies to better support patients living with obesity. This project was recognized internationally and is helping to transform care standards and ensure that patients receive the respect and support they deserve. In conclusion, while both the U.S. and Canada recognize obesity as a serious health challenge, their approaches reflect deeper differences in government priorities and healthcare systems. By examining these strategies side by side, we can better understand what works, what doesn't, and how both countries might improve their fight against obesity moving forward.